our community's healthcare angels from Henry Ford Jackson. We have nurse practitioner in psychiatric mental health, Felicia Richmond, and nurse practitioner from the Henry Ford Hospice Home, Melissa Dozer. Welcome to the show.
Thank you.
Welcome back.
Yes, thank you.
Yes.
I'm a regular now.
You are. Melissa was just here a month or so ago. We were talking about the golf outing.
Yes, it was very successful. Wonderful work on both the credit unions and our hospice workers. It was a phenomenal event.
Great job, and really what a great service. Very rare that a community has a not-for-profit hospice home. And I guess we're pretty lucky. We don't even realize how lucky we are.
It's a gem in the Jackson area, and we are very lucky.
The other thing that I would say we're lucky about is the focus on behavioral and mental health at Henry Ford Jackson Hospital. And Felicia, you are an angel in behavioral health. And it's really, people don't really think about that. It's pretty much physical health when you think about the hospital.
Right, yes.
But there's a lot of focus on our minds and our mental health.
Yes, on depression, anxiety, bipolar, just mood disorders. It's all the things that touch the rest of our life that we don't focus on. So I said to a patient today, if mentally he's not okay, nothing else is okay. And he just kind of looked at me and was like, that's true. You know, you don't have the stability or the stamina to take care of all the physical stuff. If mentally you're depressed or you're sad or you're anxious, you can't leave your house. So I was really honored to be on Jackson Magazine and to be honored and awarded the Healthcare Angel Award. And when they told me the focus was going to be on mental health, I was very humbled because it's work you do behind the scenes. Not a lot of people talk about mental health. There's a stigma. They're embarrassed. They're ashamed. Mm-hmm. So I thought Jackson Magazine did a great job.
I find it very interesting that for both of you, your career choices, your focus on what you do formed by crisis and tragedy. In your case, Melissa, it was 9/11. You were actually there at ground zero after the attacks.
Yes.
How did that happen?
At that time, I had got my degree in public safety administration, and following the 9/11 attacks, I was working for the Red Cross as an employee, and I was sent out to Ground Zero to do some logistical management. And it was there that I saw the wonderful emergency workers and thought, I think I want to change my career. And so I came back and started going back for my general ed classes and ended up going into the nursing program.
And it's to our benefit that you did.
Why, thank you.
Yes, welcome back. Thanks for doing that.
Thank you.
And Felicia, for you, it was the COVID pandemic that kind of changed your focus.
Yes, prior to that, I had been in mental health as an FNP, a family nurse practitioner, for 6 years, and wanted to do something different. Thought that a leadership role would be I would serve that well. So I did. I was like the collaborator. I was the coordinator for our hospital and our nursing homes, and COVID stopped my job. I could do nothing. We couldn't go to the nursing homes. Our hospitals couldn't send their patients to the nursing homes. We had to do something totally different as far as COVID centers, and I felt powerless. And with my background, I'd always been hands-on. I worked in the ER for a long time. So I asked at the time my director if I could come back to mental health, and she said yes. And I started like that Monday and then went back, signed up for my psychiatric mental health certification. So I went back and got my postmaster's at the same time.
And you found that huge need and the pandemic responsible for so many of our community's mental health issues right still.
Oh, we talk about it all the time. I hadn't realized how much it affected children until I did a clinical for children and adolescents. So I was with therapists and providers, and that's when it kind of floored me as far as what we taught them about anxiety and depression. And then my older population that I specialize in at the hospital, you think some of them like to be isolated, but when it was that bad and people couldn't come see them, it's been still, people still feel the effects of it.
And it's amazing, it doesn't affect us, it's so commonplace, things like, oh, we've got kindergartners wearing masks and diving under the desks for active shooter drills.
Yes.
Unbelievable.
Yes.
Yeah.
The way that our children live, it blows me away. I cannot believe they are as resilient as they are. So.
Well, obviously, so many great reasons for both of you having been chosen as healthcare angels. We have so many honored every year, and really, I think anyone in healthcare, they're an angel. But what did you feel when you, Melissa, learned that you've been chosen as one of this year's angels?
Well, like Felicia said, it was very humbling, but what it made me reflect on is in hospice, unlike any other medical sector, is that you really work with a collaborative team. And it really made me reflect on my wonderful team of nurses, aides, social workers, chaplains, Henry Ford leadership, who is so supportive of our program. And that's what it made me really think about, is I can't do this alone. It's my wonderful team that I work with.
I would think your job, it's got to be very difficult because you are pretty much every day. You're
Every day,
dealing with
yeah.
death.
It's hard. It gets hard. But there's moments that you can't imagine doing anything else. Just like someone being born, someone dies every day, and to just help them through that process, help the family through that process, really means a lot. And I think what is sad about death and dying is that we don't talk about it enough. And there are a lot of people that have that stigma about hospice, and they wait to enroll their loved one into hospice or themselves into hospice. And I think that is the biggest challenge for a care team, because sometimes it's a little late to kind of get everything under control.
Yeah, and in my case, my mom was in hospice just before her death, and I mean just before, because in their town there was no home. And what hospice did was they found places to place people where there would be staff 24/7.
Right.
And the place my mom ended up was not a really, it wasn't nice. It wasn't,
Like the hospice
it
home,
was
yeah.
nothing like the hospice home. So we know what it's like when we don't have something like that. It's pretty amazing. And I know you get like fruit baskets and chocolates and flowers. That's got to be
Which we love. But yes, since we are a nonprofit, every donation helps, and to sustain us, because it really takes a village to keep something like this going.
For those with mental health and behavioral health issues, it might be difficult to determine when someone's has had improvement. How do you assess improvement, and then what kinds of things do you get back from your patients in terms of I guess, feedback and gratitude for the help you provide?
You can tell with people's facial features, the way they walk in. I think that's one of the most gratifying parts of my job, is watching people walk in and they're so sad, they're so down, and it's written all over. And as time goes on and you build a relationship with them, and they start believing you and trusting you, and then you start to see the light come back in. I always stress it's not just medicine. It's all of it. It has to do with sleep, appetite. Are you talking to a therapist? What does your support system look like? Faith. I always ask about faith, because you can really pull on somebody's strength in their faith to help give them hope. And to watch them come back in and be excited, or have their family come in with them and say, you've helped change their life. That's the part that drives me every day. to keep going and keep doing what I do, because that's what I love. Now we've just changed their whole life, and there's that ripple effect, because now that person changes somebody else's life and changes somebody else's life, and now they're talking more about mental health, you know, because it's really happened, something's changed. I hear all the time, "You've changed my life." People give me hugs all the time. I think some of that is the best parts of my day, is can I give you a hug, especially after COVID.
And both of you in your articles talk about the importance of family. It's not just one person that's a patient, and you just mentioned how others are involved, but that's the same at hospice. When someone shows up, it's not just one.
Right. Yeah, we focus on the whole entire unit, and that's either blood relative, friend, and even after the death of their loved one, we still, our bereavement specialists will still follow that person throughout the grieving process. So it is a big focus. And
Now you, in addition to being one of the Healthcare Angels, Felicia, you are also on the cover.
Yes.
So what did you feel when you learned that?
Blown away, speechless, nervous. They told me, like, at the last minute, they called the schedule with my office and said to the person that answered the phone, "Oh, by the way, she's going to be on the cover." So the staff member texted me and said, "You're going to be on the cover, Felicia." And I was just really anxious to see what the picture was going to look like, because I've never been on a cover of a magazine. And I think they wrote a beautiful article, and the photographer, they were wonderful there. I love that picture.
I do too.
I
Did
do
you?
too.
It's a great picture, and you know, Melissa, you have great pictures in here
Oh, thank you.
as well. So did your Instagrams blow up?
If I knew how to use Instagram, maybe, but maybe Facebook.
Yeah, I think, Facebook blew up.
Well, I know, you know, the honor of being in the magazine is cool, but it doesn't. I'm sure it pales to knowing for both of you, you've had a lifelong impact on the people that you come in contact with. That's got to be pretty amazing.
It really is. It really is.
I've always wanted to give back to the community that helped get me where I'm sitting. So I'm humbled to give back. I live here. I'm very involved in our community because I love our community and I believe in our community. So to have somebody say, you know, "We think you've done this for our community," and to see it on paper is pretty humbling and
Yes,
amazing.
you're both big part of the community and involved in a lot of things outside of the job, and we appreciate that. And congratulations.
Thank you.
Thank you.
From Henry Ford, two of our healthcare angels, nurse practitioner with the hospice home, Melissa Dozer, and nurse practitioner with psychiatric mental health, Felicia Richmond. Thank you.